Hello and welcome. Today we'll be discussing premature ovarian failure, also known as POF or primary ovarian insufficiency. This condition affects women, typically before the age of 40, and involves the cessation of normal ovarian function. Understanding POF is crucial for early diagnosis, management, and addressing the emotional and physical challenges it presents. So, what causes premature ovarian failure? The etiology is complex and often multifactorial. In many cases, the cause remains unknown, referred to as idiopathic. However, several factors can contribute. These include genetic abnormalities, such as Turner syndrome or Fragile X syndrome premutations. Autoimmune disorders, where the body mistakenly attacks its own ovarian tissue, are another significant cause. Chemotherapy and radiation therapy, particularly to the pelvic region, can damage the ovaries. Other potential factors include infections, metabolic disorders, and surgical removal of the ovaries. Let's delve into the pathophysiology. Normally, the ovaries produce eggs and hormones like estrogen and progesterone. In POF, the ovaries stop functioning prematurely. This happens because the follicles, which contain and nurture the eggs, are either depleted or no longer respond to hormonal signals from the brain. As a result, egg production ceases, leading to infertility. The lack of estrogen and progesterone disrupts the menstrual cycle and causes a range of symptoms related to hormonal deficiency. The precise mechanisms by which these follicles are lost or become dysfunctional vary depending on the underlying cause. Premature ovarian failure affects approximately 1% of women under the age of 40. While the exact prevalence can vary based on geographic location and ethnicity, it's a condition that's more common than many realize. Understanding the epidemiology helps us to raise awareness, promote early diagnosis, and improve access to appropriate support and treatment for those affected. The signs and symptoms of POF can significantly impact a woman's quality of life. The most common symptom is irregular or absent menstrual periods, which can often be mistaken for premenopause. Other symptoms directly related to estrogen deficiency include hot flashes, night sweats, vaginal dryness, decreased libido, difficulty concentrating, and mood changes. Some women may also experience sleep disturbances, fatigue, and bone loss, increasing the risk of osteoporosis. Because POF leads to decreased fertility, many women discover the condition when they are trying to conceive. Diagnosing POF typically involves a combination of medical history, physical examination, and hormone level testing. Blood tests are crucial to measure follicle-stimulating hormone FSH and estrogen levels. Consistently elevated FSH levels, typically above 40 μ/μL on two separate occasions at least 1 month apart, are indicative of ovarian failure. Estrogen levels will be low. Further testing may be done to rule out other conditions that can cause similar symptoms, such as thyroid disorders or pituitary tumors. Chromosome analysis may be performed to screen for genetic abnormalities. An ultrasound may assess the ovaries, but in POF, they often appear small or inactive. While POF is primarily one condition, it's important to distinguish it from other causes of amenorrhea or absent periods. It's also helpful to understand that ovarian function can fluctuate in some women with POF, meaning that they might occasionally ovulate or have spontaneous menstrual cycles. However, such occurrences are unpredictable and do not negate the diagnosis. A classification system isn't formally used for POF, but causes are generally grouped by their underlying mechanism, like genetic, autoimmune, or iatrogenic. Unfortunately, there is currently no cure for premature ovarian failure that can restore normal ovarian function. Treatment focuses on managing the symptoms and addressing the associated health risks. Hormone therapy, or HT, is commonly prescribed to replace the estrogen and progesterone that the ovaries are no longer producing. This helps alleviate symptoms such as hot flashes, night sweats, and vaginal dryness, and also helps protect against bone loss and cardiovascular disease. Fertility treatment options are limited and often involve using donor eggs to achieve pregnancy. Psychological support is also essential, as POF can have a significant impact on a woman's emotional well-being. Counseling and support groups can provide valuable resources and coping strategies. Given that many causes of POF are not preventable, primary prevention is often difficult. However, certain lifestyle choices can potentially reduce the risk in some cases. For example, avoiding smoking and excessive alcohol consumption can have a positive impact on overall health, including ovarian health. Prompt treatment of autoimmune disorders and minimizing exposure to environmental toxins may also be beneficial. For women undergoing chemotherapy or radiation therapy, fertility preservation options, such as egg freezing or ovarian tissue cryopreservation, should be discussed with their healthcare provider before treatment begins. The prognosis for women with premature ovarian failure varies. In terms of fertility, spontaneous pregnancy is rare, although not impossible. The long-term health implications, such as increased risk of osteoporosis and cardiovascular disease, are significant and require ongoing monitoring and management. Current research is focused on understanding the underlying causes of POF, developing new diagnostic tools, and exploring potential therapies to restore ovarian function. Studies are investigating stem cell therapies and gene editing techniques, but these are still in the early stages of development and are not yet available for clinical use. New research into the genetic component of POF is ongoing to allow genetic counseling for families at risk.